My guest today is Dr. Michael Johnson. We have a very interesting discussion about homeopathy, which I actually know virtually nothing about. And so we get into a discussion about that, as well as some other great functional medicine and just great biohacking tips. So without any further introduction, please enjoy this conversation that I have with Dr. Michael Johnson.
Welcome to the Pot of Inquiry. Ready for some thought-provoking cerebral whipping and the destruction of ridiculous medical dogma? Want to shift those stale, moldy old paradigms? Well then, don that thinking cap of yours, get down in the cave, and join our host, Dr. Stephen Barrett, for this week's episode. Let's start spelunking.
Welcome to the Pot of Inquiry. I have Dr. Michael Johnson with me today. We're going to discuss a subject that I actually know pretty much zero about, so I'm very excited to have you join the show, and we're going to talk about homeopathy. So thanks for coming on.
Thanks for having me. I appreciate it.
Yeah. So tell me about what you're doing and how you got to where you got, and then we'll kind of go from there, because there's a lot of exploration on this topic I'm excited to get into.
Sure. I've been in practice 42 years. So I started off as a chiropractor. I was always interested in nutritional therapy. So instead of going the traditional chiropractic route, I was more nutritional therapy. Now they call it functional medicine. Right. I don't care what you call it. It's semantics, holistic healthcare. And so I practiced for 40 years in Appleton, Wisconsin. I got sick of being hassled by the state, because there became a point where the state of Wisconsin stated that chiropractors could not use homeopathy. And all homeopathy is a concept of like cures like, meaning that if you have a heavy metal toxicity, a very, very, very minute amount of heavy metals will detox that out of your system. That's standard homeopathic protocols. Yeah. I use a different type of homeopathy where I make homeopathic remedies based on the patient's blood work, and specifically the CBC with differential, which will tell me underlying toxins and infections. So I've been in practice 42 years. I had a very strong following on YouTube, and because I speak of things that not a lot of people like to hear, such as vaccinations and on cholesterol, and I'm anti-big pharma, I'll be honest with you. I think pharmaceuticals have a place in acute care, but not in chronic conditions, and many Americans have chronic conditions. So I had my channel pulled. And I swore I'd never get back on social media. In December of 2022, I had a patient. She said, "You have a lot to share. You need to get on TikTok." I'm like, "TikTok is a bunch of kids dancing." Right. She goes, "Not anymore." And I said, "Okay." So I got on then, and we have 625,000 followers to date. So the message is resonating. Most people, what you see is what you get. And it's worked out extremely well. We're helping a lot of people, both those who become my practice members and those who I make recommendations. For example, a lot of people are taking omeprazole for heartburn or GERD. Right. All they really need to do is take some digestive enzymes. So there's a digestive enzyme that I like with a probiotic and a prebiotic. I've helped thousands of people in my 42-year practice get off of the purple pill and omeprazole and all of that stuff and go more natural. So it's just little things like that that's made a huge difference for people. And coming back to homeopathy, I was very, very sick myself. I'd always used it. But in January of 2023, I developed what I thought was having a heart attack. I called the ambulance. They bring me into the hospital. It's my gallbladder. I was having a severe gallbladder attack. I also had Klebsiella pneumonia, which is pneumonia that's antibiotic resistant. So to get the fluid off my lungs, they gave me way too much Lasix, a diuretic. Mm-hmm. And that caused kidney, liver, and heart failure. So I, at one point, had 32 liters of fluid on my abdomen because my liver had failed so severely. My my kidneys were down to 26% function. They wanted me to go on dialysis. My BNP, which is a measure of heart failure, anything 900 and above is severe heart failure. I was at 1200. Now my kidneys are normal, my heart's normal, my liver has gone from stage 4 non-alcoholic fatty liver disease to stage 2, and I did it using the same homeopathic remedies that I make for my patients. That was the big win for me, and that really solidified for me that, I always knew it worked. Now I know for sure it works because it helped me.
Yeah, I think that, I know some very astute physicians who then, after they, either decided to go more into the functional medicine space or just because they were frustrated, one that comes to mind was a very prominent OBGYN, and another is really an icon in functional medicine, and they both went back to study homeopathy. And I remember as a kid, you heard that word and it was like, oh, all kinds of bells and whistles went off because it was really propagandized. And I think that might go back to the big pharma issue that you mentioned a little bit earlier too. So give me a background on it, because I know that it was developed by the German Hahnemann, right?
Right.
Back
Yes.
in what, the 1800s.
Yes. And
Yeah.
it was very successful
Yeah.
for many years, even here in the United States. And then what happened was there was something called the Flexner Report in 1910.
1910.
Yeah.
Yeah.
And
Yeah.
basically, it was Rockefeller who had leftover pharmaceutical, or I should say, leftover petroleum-based products that he
Right.
turned into pharmaceuticals. And he started financing medical schools, and he had tried to eliminate any other type of healing there was. And really, a major blow to homeopathy at that time. Chiropractic survived,
Right.
and a lot of the chiropractors picked up on it. But yeah, it was a major blow to where now, as you know, there are big pharma ads for every new drug that comes out on TV. You can't watch TV for more than 10 minutes without seeing a big pharma ad. I mean,
Right.
people are literally brainwashed with it. And that all relates back to that 1910 Flexner Report. There was a gentleman named Morris Fishbein. I don't know if you ever heard of him, but he was basically Rockefeller's front man to go out and destroy any other type of healing modality in the country, and
Right.
anything but big pharma. And big pharma wasn't exactly big pharma back then. It was little pharma, but Rockefeller was behind it, and that's what made it big pharma. So Morris Fishbein attempted to eliminate chiropractic. He attempted to eliminate homeopathy. He attempted to eliminate, there was something at the time called magnetism. People were healing with magnets. And as a matter of fact, in a couple of weeks, I'm going to go out to a conference in Spokane, Washington, on working with magnets. And as you know, now there's magnets that they're using for depression. So, I mean, everything old is new again, right?
Right.
And so perhaps some of these healing modalities that were taboo as far back as the beginning of the last century now are coming, and they're realizing that they do have a place. And honestly, like I said, medicine does a fantastic job with acute care. If you're have a heart attack, strokes, you're in a car accident, go see a medical doctor, go to the ER. But if you have a chronic condition, chronic pain, medicine isn't so great at chronic pain. Medicine's not so great with chronic autoimmune conditions. They're not so great with chronic Lyme or things like that. That's where a more alternative medicine comes in, functional medicine, whatever you want to call it. Again, I think it's just semantics, but that allows the person to be healed. Now, what I like about homeopathy is, as a person utilizing natural health care, I'm not giving the patient 20 or 30 different supplements to take. I mean, I have people coming to me who are taking, oh my gosh, 20 or 30 different bottles of pills. And they'll come in and they'll have a suitcase full of these supplements, and they're just not getting anywhere. Whereas I utilize 12 basic homeopathic remedies that I make for the patient, 3 that clear bacteria, 2 that clear viruses, 4 that clear chemicals or toxins, and 3 that clear mold or parasites. And that's what makes us different. And that's how we're able to help people that have been through other functional medicine protocols and didn't get anywhere.
So what, you may not know this, but I'm guessing that you would, but what was Hahnemann's background when he developed this concept? Was he a mainstream practitioner back in the day, or do you know?
I did know that, and I don't anymore after practicing 42 years. It's one of those deals. You know what? If you don't use it, you lose it type of thing. And when I first got heavy duty, and don't misunderstand me, I still use some what I would call mainstream regular homeopathic remedies that work out very well. Not everyone can afford my care because I do charge for a year program or a 6-month program to remove underlying toxins and infections. But there are standard homeopathic remedies that I may then refer to the patient. It's like, people come to me at all different levels. They've just lost their job, or they're in a tight situation. They've been through divorce. So, at that point, I'll recommend some homeopathic remedies for them that they can try first and see if that does the trick. But coming back to the exact history with Hahnemann, you've got me. I mean, that's stumped Dr. J on that one. And like I said, I knew years ago, but
isn't there a medical school in Philadelphia named after Hahnemann? Or is that a different Hahnemann?
Yeah. No, I think it's the same one.
Okay.
I really do.
That's interesting.
Yeah.
So help me out from a physiological standpoint, because I always like to understand kind of how the process is working. So you're saying the concept is like to treat like.
Yes.
Okay. Is there any more? Can you give me any more physiology behind that? Because it seems like these are infinitively small doses.
Yeah, I mean, it's like diluted, so refinedly diluted. It's like a drop of water. It's tasteless. It's here I'm talking standard homeopathic remedies. So you'll see like 10x, or you'll look at a bottle of a standard homeopathic remedy and you'll see 20x or 100x, meaning it's been diluted 100 times or 20 times from the original. And honestly, the homeopathic remedies that I use are based on frequencies. Everything has a frequency, and most people can understand when I explain it this way. If you drop dead this second, your body's there, all the fluid's there, there's something missing. What's missing is life force. So everything has a frequency. So I literally embed frequencies onto water, and with that frequency, that's what we're using to pull toxic infections from the patient. So, like I said, it's a little bit different concept than what people know or think of homeopathic remedies. So,
well, what's the status of homeopathy throughout the United States? Aren't there some states that are much more progressive and others that are much more restrictive?
Yeah, I mean, that's just it. Now,
before we continue with this great discussion, I just want to take a quick break to acknowledge this week's sponsor. I'm constantly exploring new avenues to enhance well-being and address any health concerns. Today, I'm thrilled to introduce you to an exciting supplement called Stem Regen, which I take daily and genuinely believe could revolutionize your health journey as well. Stem Regen stands out as a game changer in the realm of wellness. Crafted from 5 potent plant extracts, it boasts a remarkable ability to stimulate the release of your body's own stem cells from your red bone marrow. Why is this significant? Well, stem cells are the superheroes of our body's natural repair system. They possess the extraordinary capacity to morph into various cell types, aiding in tissue regeneration and repair. As we age, the quantity of circulating stem cells in our system reduces significantly, impairing our body's ability to heal and rejuvenate itself effectively. Stem Regen steps in to counter this decline by kickstarting the release of stem cells into circulation, thereby bolstering your body's innate repair mechanisms. Once unleashed into your bloodstream, these mobilized stem cells actively seek out areas of damage or injury, initiating the healing process. By incorporating Stem Regen into your daily routine, you're essentially empowering your body to tap into its own regenerative prowess more efficiently. I firmly believe that Stem Regen could be a valuable addition to your wellness regimen, especially if you're seeking to fortify overall health and vitality, accelerate tissue repair, or expedite recovery from injury or illness. This first of its kind stem cell mobilizer is changing the game in regenerative medicine. Don't wait to unleash your body's innate healing capabilities. Visit stemregen.co/Dr. Steven, that's with a PH, and use the code SBPOD to get a 15% discount off your first order of Stem Regen. Hey Spelunkers, we're thrilled to kick off Season 6 with a fresh new look and the most exciting content we've ever delivered. This season, we're diving deep into the fascinating world of human optimization and understanding. But wait, there's more. We're giving back to our loyal listeners with an exclusive giveaway each and every episode of Season 6. That's right, prizes are waiting just for you. So how can you join in on this fun? Well, it's simple. Follow us on Facebook, Instagram, and LinkedIn. Subscribe to our YouTube channel, and here's the magic touch. Comment, "Let's Spelunk" on any of our Season 6 YouTube videos to enter. Of course, please add anything else you'd like to your review. Don't miss your chance to explore, learn, and win with the Pot of Inquiry. Let's spelunk into the wonders of Season 6 together.
Some of the states, this comes back to, and this is what I was being accused of in the state of Wisconsin, is practicing as a naturopath. I'm not a naturopath. I never was a naturopath. I don't want to be a naturopath.
Right.
But usually, homeopathy is associated with naturopathic medicine or a naturopathic doctor, ND, as a Nancy doctor. And that's where, in the state of Wisconsin, once they started licensing naturopaths, which isn't a bad thing, that's when they said, okay, only naturopaths can do homeopathy. And if I wanted to do homeopathy, I'd have to get another 3,000 hours, which I wasn't willing to do because at the time I had like 35 years of experience.
Right.
It was the same as acupuncture. When they licensed acupuncturists, which was a great thing, I had studied many, many hours of acupuncture, but they came in and said, if you want to do acupuncture, you got to do 3,000 hours. And I'm just not willing to do that. Okay, I put my time in, put my schooling in. I have the experience. Just grandfather me, but they didn't want to do that. So coming back to your question, yes, there are states that are more open to it. But for instance, in the state of Michigan, where I practice now, they do not license naturopaths. I could call myself a naturopath. I don't, and I never would. But so it depends. You're right. State to state vary as far as laws with alternative medicine. Right now, the state of Minnesota, where I will be moving, is much more open to alternative medicine, and they have precedents to where they allow a broader range of care for the patient. So yes, it is state specific. And here in the Midwest, for me, Minnesota is probably where I'll end up.
Yeah, I think it's actually pretty progressive in Arizona, and I think Nevada as well is a good state for homeopathy.
Well, one thing that I did like, and I never talk politics on my platform, but one thing in the last Trump administration, they gave you this Freedom to Choose Act, which is, look, you have your body, you have a right to choose what type of healthcare you want. And I'm hoping now with Robert Kennedy Jr. in place that is extended, because there's a lot of things that have come off the market that help people naturally. For instance, IV curcumin. IV curcumin has been shown to decrease inflammation. And what happened was there was a very unfortunate incident out in California where there was a naturopath using it. He didn't have an EpiPen. If you know anything about IV curcumin or turmeric, people of Irish descent have a genetic predisposition where they could go into anaphylactic shock, and that's what happened. He didn't have an EpiPen, and unfortunately, a young woman passed away. Now, keep in mind that 300,000 people have died from Celebrex before they put a black box warning on it. But the minute that one person passed, they pulled IV curcumin off the market. So anything that's natural, the FDA tends to pull. In my opinion, the FDA is just an arm of big pharma. I mean, it's a revolving door of executives. And so there's something that we were using called lemon milk, which was developed by a scientist. Again, a great natural anti-inflammatory. That's pulled off the market. They pulled stem cells off the market. As a matter of fact, we were utilizing stem cells in our clinic from 2016 to 2020 or 2020, and they pulled it off the market. And then the FDA sent me this nasty letter. And all I ever claim is that we support the body to allow for maximum healing. That's it. That's what we do. It's your own body that does the healing. When you cut yourself, it's not what you put on the cut that heals it. It's your body. Your body has an innate ability to heal. Right now, you're not telling your liver, your heart, your lungs how to work. That's innate intelligence. So everything that we're doing in natural healthcare is working with that innate intelligence. That's how I see it. And that's how we get our patients better.
So I've got to ask you, on the IV curcumin or So I would imagine that couldn't be classified as a homeopathic drug, because you're talking about a real small quantity with homeopathy, where that is probably a higher dosage.
So I don't use homeopathy or homeopathic remedies in and of itself, just conclusively. I use anything out there that's natural, that's going to help the patient get better faster. I'm all about helping patients heal faster.
Gotcha. Okay.
And I think it's important that a lot of functional medicine doctors don't do enough testing, and those that do, they're not running a Dutch test. A Dutch test, I think, is very important to look for hormone pathways, levels of hormones, adrenal function. They're not running complete blood work. By that, I mean they're not running the inflammation markers like ferritin, C-reactive protein, homocysteine, fibrinogen. You could also run IL-6, IL-10. So they're not running that. They're not running, especially physicians, medical doctors, they're not running TPO and TGB antibodies because they don't really know what to do with an autoimmune thyroid. They're not running vitamin A to vitamin D ratios, which I feel are important because everybody's taking D3K2. They're not looking at the vitamin A to vitamin D ratio, which should be 3-to-1. And if you run a CD4, CD8 ratio, that will tell you the strength, the function of your immune system. Nobody's running that. Nobody bothers to look at GGT from a medical standpoint. GGT is a liver enzyme that will check to see how toxins are affecting your liver. The reason medical doctors won't run it is because they're giving medications which are hepatotoxins. And finally, nobody's looking at the copper to zinc ratio. Should be 1-to-1. Everybody talks about zinc for your immune function, but nobody looks at that copper to zinc balance. So I think there's a lot of testing that could be done with patients to get to the bottom of their issue that really isn't. So coming back full swing, homeopathy is a part of my program, but it's not just my program. It's not exclusive to it.
Understood. Yeah, so I just wanted to get that clarification, and I get it. I mean, we have to integrate, some people call it hybrid practices or whatever, but you have to integrate everything you possibly can to, optimize the basic metabolism of the human.
Well, and as you know, some patients are an enigma wrapped in a riddle surrounded by a mystery, meaning that nobody's able to figure out what's going on with them.
Right.
So where I think you really have to do a deep dive into what's happening with their system and why it's happening. So that's an important one too.
Well, I think there's a couple of things that are, so locked into the mainstream medical philosophy. And number one is what you mentioned in 1910, the Flexner Report did a great disservice, in my opinion, to overall health. And that that could be a discussion for about 6 episodes on a podcast on
Right.
how that worked out.
Right.
The second thing is that affected the training tremendously in medical and surgical programs. And so we became symptom treaters rather than health improvers.
Right.
And so
way to put it.
And if you just chase symptoms, all right, one symptom, one drug, one condition, one surgical procedure, or 10 surgical procedures or whatever, you're kind of missing the whole boat. And I just gave a lecture this last weekend up in Nashville where I was talking about, they were asking me to talk about peripheral neuropathy and how to treat it. And basically my premise was you can't treat it very well unless you get it. You can be the greatest artist in the world, but if I give you a horrible canvas to paint on, that picture's not going to be very good. No matter how, I could be Leonardo and I couldn't paint if I've got nothing that the paint will stick to. And that's what happens with humans, I think, in a lot of our systems, that we try to treat these symptoms, but we don't look at what's causing all of the symptoms, the core problem.
Right.
And I think that's a big deal. We're always trying to get, homeostasis. We're trying to, get people where they're, more protected. One of the things, that I always recommend for everybody that has peripheral neuropathy is nitric oxide supplementation. And you made a great comment earlier where you talked about the proton pump inhibitors, and, those are disastrous. People take them all their life and then they don't realize why they keel over with a cardiovascular event when they're 60, and that's because they're just not making any nitric oxide. But anyhow, that's a long diatribe to just say that I think we're now in the post-COVID era. I think that people now are turning more and more to the functional medicine rather than the traditional mainstream medicine.
Well, it's interesting you say that because I've seen a shift after COVID. I've had people come to me and say, look, I would not have been open to your message had it not been for COVID and what we went through.
Right.
Good or bad.
Right.
Getting back to your point on peripheral neuropathy, which I have because I have MS. So I have worked through it. Just so your audience knows, that the nitric oxide component is because you want to open up the blood vessels, increase the nutrients. And you're exactly right. That's vital. And one of the best ways to get nitric oxide naturally is sunlight, UVA light. There's study after study after study that shows that UVA light and UVB light are actually good for you, and they're not as toxic as what all the dermatologists are telling you. And
that's an interesting thing too. So my question is, we've been beaten up about, all right, you got to have the SPF 50 on all of the time and cover up every square inch of your body and peek out of your pouch and your whatever you have over your head. Why is it that melanomas predominantly are in the truncal area in non-traditionally sun-exposed areas? I've yet to understand that.
Well, part of it is blue light. If you read the research on melanoma, excessive amounts of blue light, not just from your screens, but there's blue light everywhere. A lot of it is related to melanoma. So the culprit is more blue light than it is sunlight. Sunlight, not only UVA, but UVB, which is great for melanin. Melanin's great for your brain, your heart, and your liver. But you also have red light. Red light supports your mitochondria. Your mitochondria are the powerhouse of your cells. Near and far infrared. One of the things we use is a red light with all our patients just because it supports the mitochondria. One person you might want to consider is Dr. Jack Kruse. I don't know if you know of him or have heard of him, but he really did a deep dive into sunlight and how sunlight is not the enemy. Blue light's the enemy. So it might be a consideration for a future podcast.
Yeah, that would be great. I always love to get into stuff that are, maybe not mainstream topics, but like what
Right.
we're the discussion we're having now, I think is very interesting. But isn't blue light part and parcel of sunlight? Doesn't it encompass
It
the
is.
entire spectrum?
You're exactly right. It's a small fraction of sunlight, where the opposite of blue light is red light. So that's the fix, so to speak. And
Okay.
you get up and watch the sunrise or see the sunset, that's 80% red light.
And now a message from our sponsor. Well, folks, if you are over 40 and you are not using a supplement to augment nitric oxide production, you should really rethink that. This molecule is absolutely imperative to the health of so many bodily functions, not the least of which is cardioprotection. If you have any question on nitric oxide, I suggest that you register with Approved Medical Solutions and begin receiving their educational emails. I never miss a day of nitric oxide supplementation. That's how important it is. Long overdue, Approved Medical Solutions created the only nitric oxide replenishment formula without oxalates. Approved Medical Solutions does not use beet, spinach, or arginine. Approved Medical Solutions is proud to offer our audience their oxalate-free nitric oxide formula. If you are not a healthcare provider, you can still get started by going to approvedmedicalsolutions.com and use the code SBarrett at checkout, and you'll receive a 10% medical discount savings. You can register to receive educational emails without any purchase. For licensed practitioners, you too can go to approvedmedicalsolutions.com and get registered today. They have unique bundles for all of the full-fledged spelunkers of the Pod of Inquiry. Use Pod of Inquiry at checkout after registration. Here's a little secret. If you order their testing strips and test every patient for a few clinic days, you will see every one of them be deficient. When they see this result, they will want you to start them up immediately. Now, thanks to Approved Medical Solutions, you can give them the best care without the worry of oxalates.
And so I'm up in the northern latitudes in upper Michigan. I was up watching the sunrise this morning, and it's 20 degrees, and there's, it's like 10 degrees with the wind chill. Because coming back to that, everyone's heard of cold plunges now. Cold plunges are the big thing. That supports your mitochondria. I'm not a big fan of cold plunge for me, myself, and I, but I'll sit outside in the cold for 10, 15 minutes in the morning with a cup of coffee, watching the sunrise, getting red light. And that's I feel it's a very important part of healing. You want to reset that circadian rhythm. There's millions of people out there with sleep issues and insomnia.
Right.
And if they would just start resetting their circadian rhythm, get some sunlight, and this is what really upsets people when I say this, but I'm going to say it anyway. I recommend some people in northern latitudes, or like I'm at, go to a tanning bed once a week. Not every day. Don't do it. You are going to end up with a melanoma if you go every day, but just once a week, just to get that UVA, UVB light, so you can help reset that circadian rhythm, and you will sleep better.
Well, it's kind of like everything, isn't it? Dosage.
Yes, exactly. Moderate, right?
Yeah, yeah. So, I mean, I think there's a lot of merit in that, but this kind of goes down the line that we've kind of already been following is that you get propagandized.
Right.
You've had everybody beating you up that you have to be with the SP50.
Exactly.
For, I don't know, hell, since I was a kid, and it's hard to overcome that. It's kind of like once these medical dogmas become established, they're repeated so much that they have to be the truth.
I totally agree. And I agree with the dermatologists when you have people who are lily white and then they go down to Florida on vacation and then they're Larry the Lobster the whole week. Yeah, you are going to end up with skin cancer if you continue down that road.
Right.
You gradually build up your solar callus. I don't, you really, and red light really does help with you not burning. And I've noticed that myself.
Right.
So that's an important part. The other important part that a lot of people are waking up to, especially after COVID, and I'd like to know your feeling about it, is diet. I mean, I recommend a lower carb diet to people.
Right.
I'm not saying eliminate carbs, but less processed food. I'd like to see people meat, seafood, vegetables, low glycemic fruits, berries, fruits with a pit. And if you can, grass-fed beef or free-range chicken or farm fresh eggs. And if you can, wild-caught seafood. And if you can, organic fruits and vegetables. But not everybody can do that. I get it.
Right.
But do the best you can with it. And I don't think people can be taking a ton of supplements because it's a supplement. It's not a replacement. Eat a crappy diet and think on the other side of it, they'll take the supplements and they'll be healthy. That's
I agree with that 100%. And the same analogy goes with exercise, which is vitally important. But a lot of people say, oh, well, I can eat the big piece of cake tonight because I ran this morning.
Right.
Like, no, you can't do that. It's not just a single arm thing. You know, I mean, it's like you have to do it all. And I agree 100%. And the problem is that, and I try to be very judicious when I go to the grocery store. I try to look at the labels and everything. And sometimes I don't. I get kind of like, this looks pretty healthy and everything. And then I'll get home and I'll look at it. It's like, shit, man, this is sunflower oil. Or it's canola oil. It's like, God damn it. Don't tell me it's healthy if you put that shit in it. It's ridiculous. And, just I don't want to beat up on Chick-fil-A because I used to love Chick-fil-A.
Right.
But you look at what's in their sandwich, like 42 different toxins and everything. It's like, what's going on? I mean, the poor human right now running around doesn't have a chance.
Right. I agree.
Between mold, between toxins, all of the stuff that's in our milieu of just existence. It's just very, very difficult. But
exactly. I agree 1,000%. I mean,
well,
but I think it's coming. And like I said, I'm hoping for a shift within the next year or two with Robert Kennedy Jr. I don't know. Too early in the game to tell. I don't know what's going to happen. I see him sitting around with Trump and Vance eating McDonald's, and he have a very happy look on his face. But,
right.
Well,
and like, it's like, okay, great. Steak and Shake is going to now use beef tallow. Well, that's a big improvement, but it's kind of like saying, well, you know what? I'm going to shoot you with a 22 instead of a 30-06.
Exactly.
It's a little milder bullet. It's not going to hurt as much. It's not going to destroy as much, but it's still, a French fry is a French fry, whether you put it in beef or not. But I think that, society is starting to wake up. I don't know if RFK Jr. is going to be able to slay that beast. That's kind of a David versus Goliath thing in my mind,
Yeah, I don't know. I'm hoping for good things. I mean, just from the standpoint of using Roundup on wheat. So there's this big gluten out here in the United States. But if you go over to Europe where they don't use Roundup on wheat, the people can eat the wheat, even in Syria. Right. When they come back to the States, they can't eat the wheat. They're allergic to gluten. I think that comes back to the pesticides and herbicides that are used on the crops.
Let me ask you a question about glyphosate because, and I don't know if this is true, but I read that they use glyphosate not only as a insecticide or weed control, but also as a drying agent. So
that is very true. At the right before they harvest wheat, they put it on. Now, I said that on my platform on TikTok, and I got beat over the head by wheat farmers, and we don't do that anymore. It turns out they still do it. Yes, they do.
Well, I heard they do that with oats.
Exactly.
And that there's the glyphosate content in oatmeal is crazy. It's crazy.
Yes, and the same with soybeans. So corn and soybeans are big in the state of Wisconsin. When I lived in Appleton, they're everywhere.
Right.
And toward the end of the season, that's what they're doing, especially wheat. You're right. Oats and soybeans, they add what most people know as Roundup. Some people know it as glyphosate. Some don't. Right. But to stiffen it, to get higher yields. It's all about higher yields.
Right.
And I think, again, that comes back to the toxicity of there's so many toxins out there, you don't even know it.
Right.
And you don't even know the chemicals that you're coming in contact with. Just as you mentioned, looking and reading at the labels and the seed oils.
Yeah. It's crazy. Well, they say there's what, about 600 to 700,000 items in an average grocery store, and about
Yes.
what, 100 are edible.
Yeah, exactly.
I mean, pretty much you just got to stay on the outside of the whole store, because anything else is all bullshit.
Right. It is.
It's crazy. It's crazy. It's kind of interesting how our life expectancy has not increased over the last few decades. In fact, it's decreasing. And, I think that it's part of just all of the stuff that we're running around in, that if the average human being knew what some of this stuff was in the food, they'd never eat it.
Right.
I mean, from an educational standpoint, but nobody thinks about it. I mean, I just really started thinking about it like 7-8 years ago. It's like, oh, maybe I should really think about what I'm putting in my pie hole every day.
Well, I've always said that big pharma and big ag are hand in glove with one another. And, when I went in for my gallbladder, the first thing the ER doc asked me is how many medications. I was 63 at the time. I'm 66 now. How many medications are you on? And I said, none. And he goes, no, I asked how many medications. I said, none. I said, I don't take medication. He goes, normally someone that's 63, we see on 7 to 10 different medications. I said, no, well, that's not me. That's not what I do. Right. So.
Well, the other thing you mentioned about seeing these pharmacology or big pharma ads on TV all the time. And I heard an interview with Callie Means where she talked about the fact that they're not really trying to sell any drugs with those ads. They're just trying to control the media because they have such a big advertising budget that then they can shut things down.
I totally agree. I think that's what got me booted off of YouTube, to be honest with you, because I was very vocal against it and I had a following. Right. And now I have a following on TikTok with 625,000 followers, and I have to be very measured in my response to some things. Certain medications, obviously vaccinations, obviously the COVID vaccination, which I never had, my family members never had, but I will tell you, in working with patients, I have a lot of men in their 20s who had the full realm of the COVID vaccinations, and I'm seeing low testosterone and cardiac issues in all of them. And so we're clearing those toxins. So yeah, it's crazy how much control big pharma really does have. And I totally agree with Callie Means when she said that. Yes, right. I remember seeing that.
Yeah, no, it's interesting. So how can folks get in touch with you? We'll put this in the show notes if they're
sure.
You mentioned that you do a lot of telemedicine.
Yes. Yeah.
You're accessible to everybody.
Yeah. I have to have all of my contact in one place, which is email. Okay. And my email is drmlj83@gmail.com. So it's dr as in Dr. MLJ, Michael Lee Johnson, 83. That's the year I graduated from Palmer, at gmail.com. That's my business email. And it just keeps it all in one spot, because we literally receive hundreds of emails off our TikTok channel every day. So I have staff that help me with those emails. But that's the best way to get a hold of me.
Awesome. Well, I'll put that in the show notes. I really appreciate you taking the time. And I think we're on the same plane here in so many different aspects. And, the bottom line is we just got to make people healthy. And
right.
then the symptoms and diseases will either not come or clear up.
Exactly.
So
thanks
you so much. Appreciate you. As you know, I'm passionate about learning new ways to address health concerns. Moreover, before I recommend any treatment or supplement, I always try it on myself. Today, I want to share my experience with Troche, I have investigated other phytocannabinoid formulas and found that, in general, they were not consistent or reliable in their results. What impressed me about the troche delivery technology is that each rapid-release tab is engineered to provide fast-acting, long-lasting, reliable delivery of phytocannabinoids to support your health and well-being. Many physicians understand the importance of using phytocannabinoids for physical discomfort, sleep issues, and mood. But if the formula is not reliable, most patients will give up, never experiencing the real benefits. I put this to the test on myself and actually tracked my progress. This graph shows my results for reducing stress. Troche is so serious about how well their product works, they partnered with People Science to provide the Troche Tracker health assessment application that lets you monitor your progress and works with you to accomplish your wellness goals. If you are a patient, click the link below and the patient button to register for Troche Tracker. Assess your baseline health metrics and receive a free Troche sample in addition to getting preferred patient pricing on all products. If you are a clinician interested in adding Troche to your practice, click the link below and then the clinician button to register for a wholesale affiliate account or go to the link above. I hope you all enjoyed today's show and got some truly empowering knowledge out of it. You can always follow up on anything we talked about in the show notes found at our website, podofinquiry.com. If you think you might have tickled just a few neurons inside that cerebral cortex, please spread the word to your friends and colleagues and tell them that they need to get spelunking. Also, if you can take a minute to leave a review on your podcast provider of choice, and especially Apple Podcasts, that would greatly help the show and be so appreciated, provided it's positive. And if not, then just keep your pie hole shut and stay down in that cave. Let's keep spelunking.
This podcast is designed for informational purposes only and does not constitute any medical or surgical consulting advice or imply a development of any physician-patient relationship. The opinions of guests who are featured on the show are not necessarily the opinions of Dr. Barrett or the production team. This podcast is owned solely by Barrett Medical and Surgical Media, LLC. While the show is highly oriented for physicians and healthcare providers, anyone interested in the improvement of human performance and understanding will find this a welcome goblet to sip from, or guzzle. However, no representation or warranties are made in any way whatsoever on this podcast for any products, techniques, or other things discussed. Invited guests are not vetted by the Pod of Inquiry for their qualifications and may have a direct or indirect financial interest in what they present and discuss on the show. The Pod of Inquiry disclaims any responsibility from anything taken from the show and used personally or professionally. It is a responsibility of the listener to perform their own due diligence prior to the implementation of any ideas, products, techniques, or anything talked about on the show.